Hey, Doc audience. People magazine reported that Khloe Kardashian has breast implants on the brain. Is that possible? What's the truth? I'm here with world-renowned plastic surgeon Dr. Rohrich. Rod, the Kardashians are in the news again. Khloe says that she thinks about getting breast implants all the time. Let's dissect this a little bit. What do you think?
Well, I'm not surprised. They're always on the news. Okay, the Kardashians in the news, People magazine. And she said their breast implants on the brain. I mean, usually aren't they in the chest? So, but I think, it's a personal choice. I mean, Bill, you're a world expert in breast implants. I think Khloe has every right to have breast implants. It's her choice. I don't think she has to ask her mom.
Yeah, she actually says that she thinks about breast implants all the time, which is actually very common. People think about this for years, 5, 10 years sometimes before they decide to do it. So that's very common. And also her mom, Kris, said that she's all for it and said, maybe we'll do it together, which is not super uncommon either. I've actually had 3 or 4 pairs of moms and daughters who have done that procedure.
You done it the same day?
Yep. We've had twin sisters. We've had mom-daughter combination. But the thing is that People magazine's making this it's a big deal. This is like what every woman goes through, that goes through the progression of thinking about breast implants and then researching it more and then eventually doing the procedure. So I don't find anything at all uncommon. I'm not sure why it was a story in People magazine.
It's the Kardashians.
That's right.
And I think also, again, it's a personal choice. I mean, breast implants are great to do if you do them for the right reasons.
But let's talk about why do people get breast implants, and then the urban legends of why people think people get breast implants, because I think it's very important. People, they get breast implants because they want to feel better about themselves. They want to get their body back after having children, want to fit better in their clothes. They want to fit better in bathing suits, just have a better self-image, better quality of life. Those are the reasons why people do it.
And those are all great reasons. Many of them, like you said, they want to just look better and feel better. It's kind of almost like a rhinoplasty, and it really changes them. When you see them back, 3-6 months later, it's pretty dramatic. It's almost like a rhinoplasty. They go, wow, they just feel more confident about themselves, and that's a good thing. You want to look as good as you feel.
Yeah, I can remember a lot of patients that have done this procedure, and you talk about a life-changing procedure. A lot of times things in aesthetic surgery, people misunderstand and calculate how big of a life-changing event that is. A lot of these patients, they're almost completely different people when they come in to see you a month or 3 months later, because their self-image has changed and their quality of life is different. And it's a personalized thing. Every patient is a little bit different, but I've always been struck by how profound that positive effect is.
Right. No, I agree. And that's why it's the most popular procedure done today in the USA. So let's talk about why you shouldn't have breast implants.
So what do you think what are the top urban legends of why people get breast implants?
I want to get that job. I want to keep that boyfriend. Or spouse. I mean, all those things.
Yeah, getting a better boyfriend or better spouse, that's out the window. The other one that comes up a lot is, back in the 60s when breast implants were first developed, in the 70s, it was about volume. So people just put in whatever the biggest implant they get. It's so far removed from volume now. Nobody wants to be big or huge, but I think that's the perception. People a lot of times patients will come and say, I don't want everybody to know I got breast implants.
That's fine.
I just want to feel better about my breasts, fit better in my clothes. So it's not about being huge.
Yeah. So make sure you see a board-certified plastic surgeon, a real expert in breast augmentation, and they do it in an accredited operating room. Know before you go. Stay safe. You'll get a great outcome.
And if you like this Kardashian story, you're not going to want to miss the last story on Kim's disappearing butt.